All right, so we're gonna look at, after you work on hip on axis, internal, external rotation on axis, the innominate at the PSIS follows both of those motions, all right? So again, the assumption is we've cleared the hip, which we have actually not, all right? So, and the reason to clear the hip is you don't want to have what we call a dirty lever arm, okay? We don't want the hip to not be able to spin and then it shows maybe some false hard infills on the innominate, all right? So ideally, we'll be able to bend the knee up to about 90 degrees. Sometimes people don't have the quad length and you start getting kind of excessive pelvic motion, all right? So we want to make sure we can bring the knee up to 90 degrees without a lot of pelvic motion. If you start getting too much pelvic motion, you just have to basically just go up till right before that pelvic motion starts to then work on the innominate or hip mobility, okay? In this case, we can get to 90 degrees, which is nice. And now I'm going to get on medial aspect of PSIS. I like to gap PSIS or work into hip and innominate internal rotation before I then work into a more compressive position of PSIS. Okay, so to gap it on this right side here, I kind of like to feel pure gapping versus inferior bias versus a more superior bias, and it's more of an inferior bias for her here. So now I'm going to come on the medial side of her foot and ankle. I'm taking her into internal rotation, and she has a lot of internal rotation here, so I'm just feeling when that starts to engage up into my hand. Okay, so just think, she has to run out of hip passive motion before we can translate that force up to the next joint above, which is the SI joint, okay? So right here, the PSIS wants to move, but there is a little bit of a hard infill, so I'm gonna work on that. So I'm pulling I'm pulling inferolateral, and now I'm tractioning up through her leg. Hold here, don't let me move you. And let it go. Good, and I'm just continuing to relocalize to the hard infill. Hold there, don't let me move you. Good, and let it go. Okay, so that's working on innominate gapping, right? Or innominate internal rotation. Okay, now we're going to go into innominate external rotation or innominate compression on the sacrum, PSIS compression on the sacrum. Okay, all mean the same thing. So now I'm going to come lateral on the PSIS here. I'm going to take her leg towards external or hip into external rotation, which we have to run out of hip external rotation, and it's starting to come off axis a little bit, so I don't want to treat the hip before doing this. To then get to where the innominate should compress on the sacrum, or where the PSIS should compress on the sacrum. Now we're here, and so now I am tractioning up through my leg. Hold there, don't let me move you. And let it go. And basically my intention is just for the PSIS, and hold there, don't let me move you, to compress on that sacrum. That okay, Kelsey? Mm-hmm. And let it go. And you just want to check, make sure that you're not causing anything that their internal alarms are going off with this one of like, oh, this feels like it's bad, this feels like it's hurting me. Because again, I mean, this area for people that are hypermobile can be kind of a sensitive mobilization. For most people, it's totally fine, and the innominate needs to be able to compress onto the sacrum. So after you clear hip internal, external rotation on axis, then go to innominate internal, external rotation on axis, and that was the purpose of this video.